Hello and welcome. We're really pleased that you've joined us today for this London Data Week webinar. We are recording the session so that you can revisit it afterwards. It's going to involve a few chances to do some active thinking about your data and its uses, and we'll also answer your questions at the end of the session. To ask us questions, please use the Q&A function at the bottom of your Zoom window. And while you're here, we're getting started with the introductions. Please post in chat who you are, what company you're representing, organization, and what's your interest in learning from this webinar. Start off with some introductions. My name is Leo Griffiths. I'm a data engineer at Montague Private Equity. I previously worked in technology consulting and at a tech scale-up. I specialize in building scalable data platforms, and I've been a volunteer with DataKind UK for 3 years on the Scoping and Impact Committee, on Data Dive hackathons, and on a long-term data core project for a charity. I'm Melissa.
I'm Melissa Coe. I'm currently a senior data analyst at the Health Foundation. My background is in epidemiology and statistics, and I specialize in sort of causal evaluations and causal inference methods of healthcare data. So really trying to figure out sort of what kinds of, whether or not interventions have actually caused some sort of change. And I've been volunteering with DataKind since before the pandemic through Data Dive weekends, and I was a member of the community committee. So doing work to try and make the volunteer experience a bit better.
So we'll start off with a poll. We have a short poll to find out who's joined us today and what kind of things you do with your data. So as the last few finished replying to the poll, the vast majority, just about majority is charity sector, supporting 6%. There's a lot of social enterprises, funds, funding and grant-making organizations that are registered as a charity. And then public sector and for-profit are represented. And in terms of the uses of data, there's quite a broad split. So 63% say monitoring our overall impact and evaluating the effectiveness of programs at a similar rate. Also reporting to funding stakeholders. So those kind of three are very important and common across a lot of the attendees here. Also, the next group is kind of around planning future program development, then campaigning and fundraising, with about 30%. Predicting future need and improving operations, simply around 39%. I'm interested to see the other sections, but these might have to wait. So there's quite a lot of messages in the chat until the Q&A. So today, now we know roughly who is here. Here's a quick overview of what we'll look at today. We'll start off with framing your problem, then starting a data audit, using open data and proxy data to enrich what you have within your organization, and keeping projects alive and working within the teams in your organization. This will be quite an interactive session, so with session worksheets, the exercise breaks, and links throughout. First, a little bit about DataKind UK. DataKind UK is a charity with a vision of a strong, thriving third sector that embraces data use to become more impactful. We use the third sector as a blanket term to cover charities, social enterprises, community groups, and more. With our impact, DataKind has been working since 2013 to support the impact of the third sector, which is often left behind when it comes to developments in technology. We provide free expert support to third sector organizations across the UK, ranging from national and umbrella bodies to local hospices and food banks. And we're able to do this because of a fantastic community of volunteers who give their time and skills, and also to the staff as well at DataKind UK, who are excellent. They are all experienced data professionals from a huge diversity of backgrounds. And here are some pictures of happy volunteers from the past few years, including some of the online events during 2020 and COVID.
Cool. So we're going to start off by using some real life examples of some of the projects that we've worked with to show you how you can frame some of your organizational issues and help you assess whether data can help you solve them. Next slide, please. So we often come across organizations who say things like, we've got all of this data, it must be useful in some way. And to a degree, that's usually true, but it really helps to have a direction to point towards. So we say that good data problem or good data project needs a well-framed problem, relevant data, a simple enough approach, and ethics baked into it. So when we're asked about how any third sector organization can use data more effectively, we want to start first with what that problem or challenge the organizations or individuals in the organization are facing and trying to solve. And usually that's actually quite like the hardest part of doing that is figuring out what you want to know. Next slide, please. So we're going to start off with just a quick example to kind of give you an example of an organization trying to figure out what this problem is. So one of the organizations we worked with previously was SmartWorks, which I don't know if you know about them, but they exist to inspire and empower women who need help getting into work. So they've got 11 centers across the UK. They provide interview and career coaching alongside high quality workwear that helps women enter the workplace. And of the women they work with, over half are from minoritized ethnic groups. More than a third are lone parents, and nearly half of them have been unemployed for over a year. So they've worked with 30,000 women in the last 10 years. But they wanted to know where there is additional need for their services. So they had a hunch that with over 632,500 unemployed women, across the UK or in the areas that they operate. They knew that they weren't reaching all of the women who could benefit from their support. And they wanted to understand, they had this challenge of identifying where the gaps were in that provision, and they wanted to understand that better with data. Next slide, please. So we started off by sort of framing out this problem. This is it's quite a broad problem to say that we can't find all of our potential beneficiaries. We wanted to frame it into something that's got clear actions for SmartWorks. So we came up with this problem statement, which ended up being that we want to know where eligible beneficiaries are missing out on our services. And then there's an action that comes along with it. If we find out those locations, we can then work with relevant local authorities to plan outreach to these women in order to offer them support. So what we ended up doing in this project was tackling this question by mapping publicly available data from the census, an annual population survey to show women's unemployment rates by local authority. So you can see that in this map here. And then we then compared that to the number of SmartWorks clients in each of those local authorities, and also mapped the existing centers that SmartWorks had on top of this data. So we've got this nice little visual here of where the locations of all the centers are, those little buildings, as well as a heat map that reflects the unemployment by local authority, where a darker color green means that there's higher unemployment. So SmartWorks is able to then use this to try and identify, here are some areas where maybe we've got a center and there is a lot of employment. So we're maybe able to, work with that population. Or maybe there are some darker areas here where there's a lot of unemployment, but we don't actually have anyone sort of working directly in there. And maybe that's somewhere we could look to focus next time. So we'll walk through how we we developed this problem statement. Next slide, please. So a good problem statement, if you think, has 4 key things. It reflects some sort of hunch, it identifies a gap, and it's actionable and specific. And I'll kind of walk through what each of those means in the next slides. Next slide, please. So the first thing is to start off with sort of what is a hunch that you've got in your organization. So for SmartWorks example, they know that there's lots of young people in the area that we're not reaching, or sorry, maybe this is not SmartWorks example, but for one example could be that you know that there's lots of young people in your area that you aren't reaching, or for SmartWorks, like there's lots of women that we might not be reaching. And it'd be helpful to sort of think about what kinds of hunches you've got and what can be tested with data. Is there something that everyone in your organization kind of knows, but there's not really like a specific number that you can put towards it? Or if there are people who are delivering services on the ground, do they have like a hunch about something that some kinds of patterns they've been noticing but don't have data to back up? Or are there any sort of assumptions that you're making that you can prove correct with, given like the right kind of data that might give you evidence and be able to sort of, further support specific types of programs or take further action if you only had that data? Or maybe there's assumptions that you actually don't know if they're correct and you might want to see if they're verify that they actually are true. Next slide, please. The second part of this is that we want to identify what that sort of gap is. Like, what is it that if you only could see that, or if you only knew this piece of information, then we could do something about it. So, for example, this is a really common one, and this is sort of the SmartWorks one, but we want to know where areas of need are compared to where our clients come from. And to do this, you can think about sort of what are your biggest pain points and struggles, and is there something that you really need to know to kind of clarify this, whether or not your hunch is correct. Next slide, please. And then sort of comes the action. So if we could see, or if we knew this information, so if we knew where our areas of need were compared to where our clients come from, then we could better locate our advice hubs and service providers. Like, what would you do knowing the data that you've got? And this should obviously relate to the overall mission of your organization, and think about sort of who would act and when and how you would act. It's also really important here to think about sort of whether or not solving that problem that you identified is within your control, or whether it's something that's like sort of a huge and wider issue, and sort of thinking through what your sort of organizational theory of change is, to approaching that. Next slide, please. And this kind of goes along with sort of what I said before, but having sort of more specific problem statement is really helpful. So your sort of overall broad problem will be something that's related to your organization's mission. Something like young people are struggling to find jobs, or women are struggling to find jobs. A large proportion of global food supply is wasted. But having a much narrower problem statement will help you actually come up with some concrete actions. So something like, we can't predict which classes or products or events or things, whatever programs you host will be popular. And identifying that, sort of solving that through data will then help give you some clear actions to move. Or something like, we don't know why some people succeed or fail in our program, or we don't know if we're reaching our right target audience. They're not the same as your overall organization mission, but they support it in a smaller way. Next slide, please. So we're going to move on to an exercise in a second. We've got some worksheets that you can fill in, or you can either do this on your computer, on a piece of paper, but just some prompt questions to help you think through those. We're basically going to ask you what you think, what kinds of hunches you've got. What is your biggest hunch or struggle? And so you can think about sort of what is the hardest part of your job right now? What do you wish you knew? What's blocking you currently from achieving your organizational mission? Next slide, please. So we have a worksheet that Nicole, I think, has already put in the chat. You can make a copy of it. It's effectively just answering this question: what is your biggest hunch or struggle? Feel free to just write this down on a piece of paper. Feel free to type it in the chat if you want to sort of talk to other people, or if you got something really exciting that you think you've come up with. And yeah, I'll give you about 3 minutes to do this. As I said, as we are showing here, if you want to use the worksheet online, this includes all the other worksheets as well for the other activities that we're going to do. Just make a copy of it, because I think it's read only, so you won't be able to edit it otherwise. But yeah, I'll give you 3 minutes. We'll come back at 12:20. Feel free to type in the chat if you've got any things to say.
Okay, so continuing on. Now we'll look at the second part of the formula, ensuring that you have the data you need to answer your questions. So we've broken this down into the types of data. So what question do you have that can answer the questions that your organization is facing? So this could be user data, so the data that you capture for your users or beneficiaries. For funders, this could be your fundees or applicants, so earlier up in the pipeline. For service delivery organizations, it might be demographic characteristics, reasons for coming. But then when they work with your service, it might translate to engagement data. So this is how people engage with your services, which establishes the extent to which people use your services and how. This can include things like case records, case notes, record of activities. It doesn't necessarily need to be structured, organized data in a database or a system. It can sometimes be text and words, and that can still be analyzed and get some interesting insights, especially with large language models nowadays, so things like ChatGPT. Then there's feedback data. This is data from your beneficiaries asking about what they liked, what they didn't like, or otherwise gives feedback on your service. These could be feedback scores or survey responses. And finally, there's outcome data. So this is the feedback and the perception of the service, but this is measurable outcomes, or qualitative or quantitative, of the service provided. I'm saying service here, but other organizations can still apply the same approach. This is data about what has changed as a result for people working with you. It establishes a short and long-term impact. So that covers the whole operations and sometimes even the strategy of the organization that you're working with. and there's normally data or ways of collating or accessing data to interpret that. So your data, for each data set you want to use, you should be able to describe the following. Um, so for the previous slide talks about where you can get your data from. So where you would look for from it. You can look at the systems which you're accessing. So if you have a tool like Charity Log or a CRM, there might be various tools that you could work with. But for a given data set, you want to understand you want to be able to describe these things about it. So the origin, where does the data come from? How is it collected? Maybe sometimes you're influenced by funders, what funders want you to collect. And the important difference here is that it might not necessarily be the best measures for your operational work as an organization. It's also important to factor in the ethical considerations. So would the subjects be aware of, consenting, and happy with the use of their data? Next is the timing. So when the data was collected, for example, the pre-programmed data is collected through a survey that goes out at the beginning of a program. How long the data was collected, for example, this represents 5 years of program delivery, and how often it is updated. So we collect the data for each year of a program, so when our program starts in September. These first two cover some important assumptions that can lead to a lot of confusion with data. So you want to know what data is captured and how that is, when it is captured, because that gives you a lot of context about using the data. And the timing as well can help you get an idea of how that plugs into your organization and what it is actually measuring. Next is the amount. So how many rows there are. For example, we have 1,000 rows for each year of a program. So in total, we have 5,000 rows of data. But importantly, with the amount is the content. So what each row represents represents to us. So a row could represent a single pupil's data for that year. So that way you know there's not 5,000 pupils in the scope of this data set, but it's at 1,000 students per year. And there might even be people who've attended multiple years as well. So you have an idea of what you're working with and avoid some confusing analytical errors. Further, a data dictionary can tell us what's recorded in the important column headers or variables and what is held in each column. This is vital. It tells you how to record the data specific to your organization and what it means to you. You might have some systems that have generic definitions or use kind of structures that help make it easy for you. But sometimes your implementation of it or your organizational context might mean that there's some nuance to it. That it might mean when you register someone as a client, that might be a different stage to what the CRM system might expect from you. So it's important to have a data dictionary capturing those nuances of the organization. So that way, when you use your data for your analysis and to solve your problems, you have all the context that you need. Fifth is access. So what system is it on? What format is it stored in? How can you access this? How can you extract this? For example, if your data is stored in Salesforce, it might be managed by a third-party organization. You might have to submit a request for the data with 2 weeks' notice, which is important for budget planning, but also for the time and cycle of development. You also might need consent to share data with the third-party data processors and make sure you're GDPR compliant. Finally, identifiers. As a data engineer, I love identifiers. They make your life so much easier. Whether you use unique IDs. This is important if you want to use data from multiple data sets or to track a beneficiary over time. So for that people example, over several years, if it's one people ID per year, with one people ID, you could track if there's any people who've attended multiple years of that service. For example, to change a score for the same people when before scores sit on one data set or after scores sits on another, as well. Having a unique ID against people makes it easier to collect the data sets for comparison. This could be used for pre and post program surveys, for example, and that way you can see how your program has had an impact on that people attending it. If you don't have the data you need, you can start collecting it. This can be a challenge in itself, so we're going to be quite brief on this. But it's important to think about the problem and design how you could answer that question. What information could you start collecting feasibly? Where do you have the systems and processes set up? Where can you interject with the process to start capturing the information? Maybe surveys, maybe your caseworkers can start to record some of this information. And then if you don't have data or can't easily collect it, is the data that you might contribute a similar type of information, or act as a proxy measure. So in the Q&A, we had a question from Vipul about the census data isn't being granular enough and whether that was that an obstacle in our analysis. This is where we're using census data as a proxy for analyzing the demography which we're looking at working with. So if I recall correctly, we were looking around Birmingham and looking at the unemployment areas in different local authorities in that area. And so we could find out where there were higher levels of female unemployment, where by local authority and using census data to then identify where they could target a new centre to improve their service provision to those areas. So it's not exact or amazingly precise, but it's still very useful to make informed decisions with the information. So with collecting data, you can also consider what data is accessible to you. So we've touched on census data already. You can make freedom of information or FOI requests for many kinds of organizations. Some may have a charge depending on this request. So FOI is often used for government information, and as well as some other public bodies. They may also provide them publicly. So the ONS website provides plenty of information, such as the indices of multiple deprivation, census data, and others. They also have some quite useful tools to help you to interpret the data sets or preview what they will look like before you start downloading it and working with Excel, which might be more natural for someone like me. But there's nice tools where you can log in and see for a given area, what are some of these heat maps? What if I change that heat map from unemployment to be health outcomes or something like that as well? They have lots of different tools you can work with. I haven't got a link to hand, but hopefully we can share one afterwards. For other proxy information, there may be data sets representative of the information you're looking for, even when the exact data set isn't available. So in the SmartWorks example, we had unemployment information specifically, but for example, for child poverty, you might want to use free school meals as a proxy for poverty for school pupils. Be aware that it may take time to find, access, and make open data into a usable state. And also that DataCount UK is well versed in using this open data and can support you in finding them and using them as well. Yeah, I've worked with several projects for DataKind, and nearly all of them have required open data and often very common data sets as well. So indices of multiple deprivation, census, and others. Now, we're going to spend some time mapping out your data. So grab some paper again or go back onto your worksheet. We'll come back in a few minutes, so 12:33-ish. It'll be the same link, which I'll repost, but here we'll go through this data mapping exercise, talking about the data that you have, the data you could collect, what external data sets you have, or proxy data that you could use as a heuristic for understanding what you're looking for. It might be nice to think of this, some of the ones where you don't have as a shopping list or things that you could do, thinking of the art of the possible. If you post in chat, we might be able to answer some examples of how you could answer that too.
Thanks everyone for posting as well in the chat what you I saw a lot of comments coming in as Leo was speaking. I think especially for those of you who said that like some of your challenges are that you don't know, like that you've got lots of data but you haven't used it. So it'll be helpful to kind of think through mapping out all those different data sources that you do have and maybe thinking a bit more about sort of what questions could those answer? What are the sort of substantive questions that you've got about sort of the way that your organization is working, not just about like what data do you have, but what could that data answer?
Reading through some of these, they are use cases around operational improvements, about monitoring and tracking your processes. That can also be useful for communicating your work and efficiency to help secure funding. If you know that you can, if you know how much you can do for your given resources, helping you to apply for larger funding, you can start to put numbers around the uplift. That if you had a bit more money, we could do a bit more, and put some numbers around that can help to make that a more compelling argument. There's some usage questions, so appropriate time slots for community sessions suit a wide range of people. So you might have data for people or what attendance is popular and where there might be more demand than there is supply of sessions. Or they might need to survey or understand people's calendars of availability or types of employment, whether it's shift or full time, like business hours. There's a lot of variation. I haven't got time to go through all of these, but it's very interesting to read. So we're about at time for this, but I would suggest spending a bit of time after this session to have a think about and reflect on each of these sessions, each of these exercises. Also, once you've done each one, really through them again, you might inspire each section together. It's sort of an iterative process.
So feel free to continue mapping out some of the data stuff in the next bit. But now we're going to talk a little bit about sort of planning out a data project and involving your team. Next slide, please. So when we are planning out projects, one of the big things is who do we involve and do we involve the right people? We highly suggest including as many people from as many different parts of your organization, including representatives for as many different parts of your organization as possible. Particularly of importance are including people who capture the data and actually understand what it represents. So for a service delivery organization, that might be someone like a caseworker who's advising clients and entering their details into a CRM. For an advocacy organization, that could be a fundraiser or a marketing person who's working directly with donors. Oftentimes, these are people who really know why something is being entered in a certain way. So a lot of times when we see things like discrepancies in the data, people who are actually entering the data will be able to tell you, oh, it's because of this kind of like this field limits, has a character limit, and so you can't enter more than this thing or something like that. And that gives you a lot more insight into why the data that you're collecting is being collected in that way. Definitely involving as well people who are using the data to make those decisions. So if that's someone like senior leadership, people who are going to make decisions about the organization's program and strategy, and someone who has the authority to use the data to inform their decisions or budgets. And then finally, obviously, if you've got people who are actually using the data for evaluations, if you've got a data impact or evaluation team, definitely include them to understand sort of maybe where are there places where you could collect data better so that they could use it better for their analyses. But obviously, sort of all of these people are quite important. We just recommend sort of like keying in on like who those people who touch the data at different stages are, and what would they know a little bit more about the data quality or what the data could be used for. And obviously, if you are, depending on the nature of your organization and the specific challenge you're trying to address, it could be helpful to also include the beneficiaries themselves. Obviously, that's stuff that could be really difficult to do in practice depending on your organization, but it's important to help ensure that beneficiary data is being used impactfully and that they know how their data ends up getting used and how it's improving your organization. Next slide, please. So to kind of go back to this problem framing piece, now that you've mapped out different data sources, so kind of reminding you of the example that we had from SmartWorks, we sort of have this broad problem about we can't find all of our potential beneficiaries, and we can make that into a much more specific one where we say, based on that hunch and that gap, we want to know where eligible beneficiaries are missing out on our services. And if we could find out, and now this is where the data piece comes in, if we could find out their locations or locations of other, or what's going on in other local authorities, so like knowing that now that we've got that data, we could then take action and work with relevant authorities and plan outreach and support for those women in order to offer support. So now that you've kind of got a little bit more on that data side, you can think a little bit more as well about sort of what is the action that could come out of using that data and answering that question. And next slide, please. So this next exercise kind of pulls together some of the stuff that we did in the previous two exercises. So it's to kind of create that full problem statement. So you've got sort of your hunches that you've noted in the chat. You could sort of say your organization's problem is, and like, what is the specific problem statement that you've got? And if you were able to see what is the data that you need and the information that you're missing to answer that question, and using that data that you've got, if you were able to get it, what kinds of action could you take? And like, what would that impact mean for your organization and mission? So after this, we'll come back for a bit of Q&A. I think we'll give you again another 3 minutes or so for this one, although I recognize this is probably a much harder one to solve, but you can kind of take this back with you and think about this further after this workshop. Um, but yeah, I think very much encourage you to think about sort of like a problem within your client. So I know a lot of people have got a lot of challenges with just not using data, but what would you want to use that data for if you have sort of an example question that you want to answer using the kinds of data that you have, and think about the sort of data map that you've got and what you might have available to you. And again, yeah, feel free to share this. We can have a little bit of a chat about it when we come back in the Q&A as well. Feel free to share in the chat. Yeah, let's come back at 43. Is that?
Just looking through the chat whilst people are still typing. Um, there's a comment from Susie that she uses the Office of National Statistics postcode data, but the files are huge. That's the challenge. Often, like I personally use data processing tools like Python. However, a trick for that could be getting the local authority information or the any information that helps you to narrow down the region or part of the UK that you're working in. As I believe the default download is all postcodes everywhere, and it gives you a massive file. That way, you have one effort of slowly processing it down, but you can filter it just to the scope of the regions that you need. You can end up with a much smaller file that's more relevant for your organization. I think the default is England or Wales, something like that. Um, yeah, I only work with for data voluntary, so there might be other people who know more too about this. There's a question from Gemma, which we replied to in the chat about good libraries of public data sets. We'll post more around that in the follow-up. But there's the ONS, there's health data, there's london.data.gov.uk, no, data.london.gov.uk. We'll post the links out in the show notes afterwards or webinar notes afterwards. There's also quite challenges as well shared, which are really interesting. If we have time after Q&A, we can maybe discuss a few of them or kind of share our thoughts on them. I think webinars pretty one way, but we can share any thoughts or learnings we have from our experience. Okay, on to the Q&A. So let me bring up the Q&A questions. So we covered, I think, the census data, so that not being granular enough and where that's obviously covered in the analysis. That might link towards the next question around, are you aware of the Department of Work and Pensions or DWP data being linked with health data? Assuming that you're not in government, but you might have access to more information, so you're a public organization, a third sector organization, generally it's quite hard to link data directly because of privacy concerns. A lot of the methods that we use, data kind, are to link them together at aggregate levels. So there's lots of statistical comparison at local authority levels or LSOA or MSOA areas. These are ways of cutting up a local authority, if not aware, similar to postcodes, but a bit more strictly defined for easier analysis. And so you end up doing some statistical comparisons of prevalence or other rates within these areas rather than direct linking of data. Eduardo commented that there might be Stat Explore to have a look at, or if there's further questions to do with that. From Zahid Abbas, if someone wants to embark on the first ever project and volunteering the data skills for an organization like the Wellcome Trust, what would you advise? So yeah, assuming you're working with Wellcome Trust, I would first try to understand what challenges they're facing. So the taxonomy or framework that we've suggested here is quite generic into what kind of level you're joining at or what you're trying to do. I think aligning with your project with your what the organization or your department is trying to solve within their function helps you to be able to make sure that your work is relevant and it's useful, and you get helpful feedback from the various stakeholders within it as well. Um, Other advice would be start small. Start off with very discrete answer questions and answers. Start to understand the data. If you can't answer some basic questions about like what's happening within the organization, the deeper analysis you do will often be flawed because if you're working off of kind of variance in your assumptions at the start. Um, One maxim I like is define, describe, predict, prescribe. Start off with defining what you're working with, describe what you're working with, and then start getting predictive or prescriptive analysis, saying what you should do down the road. But start off with the very basics, and a lot of that is quite hard work actually, but can also be very effective. Like I said a bit earlier, being able to describe what you do can be very compelling to funders when you put a number on it. When you can say that from your additional grant last year, we were able to serve X more users. Great. That's then they can kind of extrapolate that that the grant money is returning value for the investment for the opportunity, and so there might be they might be more likely to give a bigger grant or to renew the grant after that year. Anything to add to that, Melissa?
No, I think I was just going to, I was just typing up an answer to some of the DWP health data stuff. I think
Mhm.
probably at a LSOA level, you could link together things like information on like prevalence of conditions or
Mhm.
some other like healthcare usage with sort of things that DWP puts out at an LSOA level. But definitely, yeah, at an individual level, it's much, much harder. And in my current work, we've been doing some stuff with like sort of fit notes which come from DWPA, which have a lot of data missingness, but looking at it sort of in sort of more regional or local levels rather than individual ones, maybe gives you a bit of better sense of like what different areas look like. But obviously, it's much harder than you can't just sort of see that as easily at a like a patient or individual level, as Leo said. Um,
It also comes to
that's
the advice that we gave around making sure the question is very narrow. So
yeah.
we're talking about two major data sets, actually repositories of data sets. Often when you really narrow down the question of like if you're looking at maybe unemployment data or you're looking at poverty or other aspects of it tied to health outcomes or towards prevalence of disease or whatever your problem is actually trying to solve, it might be easier to discover the data sets, understand what you're working with. But our generic guidance is still like you can't map them directly just because of privacy, but instead working at small aggregate levels that allow you to work on the lowest kind of applicable level of detail without well, within the data, the constraints that you have for the data.
For the most part, it's not something that you necessarily, yeah, as you're saying, it's not something you actually necessarily need to do. Um, you'll have data, for example, on your clients already. And then is it necessary to know, like, sort of, yeah, I think definitely kind of keeping it simple and knowing what the question you're trying to answer is. I think there's been quite a few nice links in the chat as well that people have shared around sort of public data info. Um, thanks for answering those questions for us. Um, if anyone would like any to ask anything else, or even, I don't know if people are able to speak up, raise their hand, but yeah.
No, they have to use a Q&A function, unfortunately.
Okay,
Um,
never mind. If anyone has any other questions, feel free to. Oh, I think one's just come
yeah.
in actually.
Just before we move on to the next question, on Zahid Abbas's original question around volunteering, I guess some general advice on starting small and focusing it with what the overall direction of your team or organization is doing. But also, we link up with Data Card UK. We have a great Slack channel. We share advice, resources. You can post questions. It's very active and very helpful community. They if you're a volunteer for a volunteering skills directly to a charity, you're still welcome in that channel in the space to help share your results. You don't have to just be a volunteer to kind UK volunteer. Likewise, if you're a charity worker or for a charity or volunteer for charity otherwise, please take a look at DataCan UK. So do you have any advice on how to identify trends and anomalies in time in big sets of quantitative data? I think I'll pass this over to Melissa.
Sure. I actually a lot of what I do is looking at things over time. I suppose thinking about sort of what unit of time you really want to know. Like a lot of public data is published monthly or something like that. And honestly, the first thing that we do with any kind of data is just to visualize it. If you have like a line, draw a line out for each of the data points that you've got, and kind of see like what the trends look like. That'll help you kind of get better sense of sort of what exactly you want to do and what exactly you want to analyze. I think it's quite a broad question. So I guess if you've got any sort of specific, if there's something specific that you wanted to understand, there's definitely loads of sort of more formal statistical models that you can run on like time series data, depending on what you wanted to do. If it was sort of that you wanted to understand whether something has changed over time, but absolutely the first thing would be just to draw a line, you know, each month, like what the data point is, and like connect those lines and see whether or not you see anything, any clear patterns there. Hopefully that
Mhm.
answered your question, but feel free to type more if not.
I think as well, one of the questions is around anomalies. I think that's a very common question
Yeah.
when you start working with data, that you end up looking for the anomalies. I would say actually start with the easier inverse of that. So understand what is actually happening, what you can see, because then the anomalies start to surface themselves. With data, it's all about working with variance and not really understanding the full picture. But through describing maybe your caseload over time or other metrics like that, you start to notice as like, oh, I can describe this very well, and then there's a peak. Start to see those anomalies, because if you start looking for the anomalies first, you struggle to define what you're looking at, and they end up getting mixed up with the natural variance in the data set or what you measure. So define well what you can work on, and then you will start to follow your nose into the different areas of where there's interesting areas. That's where you uncover the insight or the anomalies that will be useful for your organization.
You want specific sort of models and things to look into, there's definitely like sort of um, there's a lot of things that you can do with time series. One of the like sort of most at the most simple level, a lot of people use sort of like statistical process control or SPC charts, which are basically the same. It is just like mapping out what's happening over time, but then you add control limits around it. So you can sort of see if points are going outside of control limits, or identifying whether points are sort of like always increasing and things like that. So that might be something to look up. And then obviously there's like some more formal like interruptive time series types styles of like doing a more like in-depth study around it.
Just going to share the next slide whilst we're still answering questions. That way people don't log off in the last few seconds. But please share feedback for this. We'll post a link in the chat as well. But also follow DataKind on LinkedIn and our mailing list from the DataKind website, which Nicole has posted in the chat. Yeah, we're a very open community, very lovely people. I'm not saying that because I'm one of them, but it's because I meet amazing people there, and it's really a rewarding place to spend your time and connect with. Also, if you're interested in volunteering, there's lots of opportunities available. And if you're a charity looking for works of support, but again, please reach out to DataKind. We'll keep answering the questions for the last few minutes of the session, but I want to give people time to scan the code or click the URL. So Frank's question, as well as identifying what data we require to produce analysis, do you have any advice on identifying data a client organization is missing or overlooking? We are very knowledgeable around primary or secondary education, but are less familiar with universities and higher education. I think I'll start off with this. I think there's a cycle of problem forming and analysis, and problem forming, discovery, and analysis, and then reforming your problem. So starting with what you've got is a great way. So if you are focused around primary, secondary data, what questions can you answer with that? What data is available? What can you extrapolate? What questions can you extrapolate to the higher education space? And then look at what data is available. There might be there's different availability data from like primary, secondary to higher, but they don't always map over perfectly. So there might be a lot better information in some areas, a lot worse in others. But focusing on your big problems, like we said at the start, I'm going to say the SmartWorks example, that are particularly important. Find out what's particularly important to you, and follow what data you can use to start forming and answering questions around that. There's a cycle. You discover data, you form problems, you try to answer it, but then you have to discover more data or start to collect data as well. Sometimes these can be quick 2 week cycles. Other times these can be years of having to collect survey data every year to start actually forming that picture. But following that direction means you know that what you need and what you can use as a proxy, and then follow through into action for your organization. Anything to add
I think
on that, Melissa?
Yeah, I think you're kind of, it sounds like you have identified something that you're maybe missing data on already. I think it's kind of, maybe this goes to what a lot of other people have commented on, which is like, how do I find out what data exists? And I think, I'll just say that I think it's also just a really difficult thing. Like a lot of data exists in really specific pockets that you kind of have to search. Maybe like one small suggestion of helping is if you do join this sort of data kind Slack channel, there's definitely loads of people who post things about, I'm like trying to find data for this kind of like on this specific sector or whatever, and where you can find it. It's a little bit word of mouth and a little bit difficult, but maybe a little more helpful than just a quick Google. But yeah, I think
Yeah.
sort of talking to people really helps, because a lot of times there's loads of times in my career where I've been like, I don't know, like I don't think this data exists, I don't know where it is, and then have like sort of few weeks later down the line found someone who said, oh, actually, like I used to work on XYZ data source, which you yeah, it's not an easy
Yeah.
problem, I think is what I'm trying to say, and it is quite
Yeah.
fragmented, all the different publicly available data, and it is a little bit just about talking to people.
Yeah, I think DataKind is a good resource for that. There's volunteers who work on projects, there's charities work on project. DataKind staff as well are active and passively involved in every project and have tenure spanning like the life of the of DataKind. So there's a lot of institutional knowledge and volunteer knowledge around it. Also, some of the volunteers are specialists, like Melissa's a healthcare specialist. I'm a data engineer, which is particularly useful for open data, but apart from processing it all together. But there's a lot of different resources you can put on. I'd say the two kind of problems you face is discovering which data set to use. So like, does that data exist anywhere? And then also, how do I use it? So if you search some like local authority data, there's a lot of census data, shape files, lots of different formats of working with it, lots of different versions of it, different levels of detail. It all gets really kind of confusing at times. So that can also be useful point to engage with like the community and ask, oh, how did you solve this problem? Because then you can see what file they use, how they processed it. So it converts it from the idea into like a useful Power BI dashboard and how they've done it. You can start to use that as a basis. Just wanted to answer the last few questions. So, Rig Vader, sorry if I pronounced the name wrong. What kind of skill sets would be useful to host in-house for data analysis based on the trends and challenges questions you've come across for nonprofits? So, as I said, I'm a volunteer for DataKind, but I've worked with a few charities. But Nicole, please chime in if you have some extra advice for this. But I say it's quite a hard question to ask because charities are incredibly resource constrained, and so you have to be very lean in terms of what you work with. The charities that I've worked with through DataKind have very rarely had in-house analytical resource. Often they've had instead focused on upskilling, so either with Power BI or some Python or Excel analysis. My immediate recommendation would just be to understand data literacy and understanding how to interrogate a data set in Excel or Google Sheets. Normally, the license is already there. There's no kind of blocker with that. It's often how people start to follow the nose anyway with analysis. So learning how to engage with the data is the most important thing. There's you can go all the way through to like Python and R statistical analysis and or data engineering like myself. But starting off with getting your hands on the data, thinking what you have, what questions you can answer with it, some pivot tables, some time series graphs, some line charts essentially, bar charts, they all help to understand how your data can answer your problem. Problem formulation and simple answers are the most effective. Hopefully that answers that. In terms of more advanced skill sets, beyond like just initial, would be Power BI or some data visualization tools. And then Python probably is Python or R is the next kind of level in very, very simple terms in a 2-minute answer. Any other advice for that? Maybe Nicole and Melissa, because of data kind experience?
Definitely, yeah, definitely depends on sort of your specific organization and what level of like sort of where you are in your data maturity journey and like how much data you currently collect, like how is it organized. And then I think that helps to kind of understand what level, what you use it for as well, like helps to understand what kinds of skills you need. Maybe like contacting happy to chat about these things further if you want to contact DataKind UK directly as well. Might be able to better answer some of those questions and at sort of more case by case basis. One thing, because we are at 1 o'clock, just to quickly say, a lot of people have asked about the Slack. I think you do have to sort of, you fill out the volunteer form as a volunteer, or if you're a charity, kind of get in contact with DataKind. And then sort of it's once you're sort of in that community, then you get invited to the Slack. But yeah, definitely feel free to reach out and connect with us. And happy to have ongoing conversations.
There's one question just in the chat, just in a bit of overtime from Rachel, around does data help charities improve the ways in which they capture data? We've just completed our theory of change with another company, which has improved our understanding of our organization's understanding of data and its importance. The theory of change has also identified clear gaps and wondered if DataKind could help with this. So I definitely look at the support available through DataKind. They do engage holistically with charities to make the best use of data and use data to solve their problems. I think they have experience working with charities like with their theory of change. Normally when I volunteer, I'm more on the project side of things. But I would definitely recommend reaching out, looking at the programs available and opening that discussion. If you're not at the project, you're not ready for the project, it's kind of still very helpful in having the conversation and saying how you could eventually get to that project or like steer you in the direction, then have the proper conversation in a few months' time where they can be formulated as a project that they can be more actively involved in. There are a few different ways of working with charities. So there used to be like hackathons as the main area, but there are different ways now available. So if you have worked with DataKind in the chat in the past, there are exciting new engagement patterns between DataKind and charities. So please have a look at the website and see what is available. I think those were all of them. Apologies if we missed your questions, but we're out of time. I just want to say thank you very much to everyone on this call and to Melissa and Nicole as co-hosts. Yes, I really appreciate your time and hope you got something valuable out of this session.
Thanks so much for being engaged. Please fill out the feedback form if you're still hanging out.